This show is part of the Recovered Life Network. Check us out at recoveredlife.tv.
For women living with bipolar disorder who are planning a family or are of childbearing potential, navigating reproductive health requires far more than standard prenatal care. Balancing maternal psychological stability with fetal safety presents one of the most complex challenges in clinical psychiatry. When a woman with bipolar disorder learns she is pregnant, the immediate knee-jerk reaction is often to abruptly stop taking all psychiatric medications out of fear of birth defects. But according to an authoritative clinical review published by Psychiatric Times, unmonitored medication withdrawal can trigger severe, rapid mood relapses, placing both the mother and the developing fetus at substantial risk. Psychiatrists emphasize that preconception planning is the gold standard for managing bipolar disorder in women of childbearing age. Because roughly half of all pregnancies are unplanned, clinicians must evaluate the safety profile of a patient's mood-stabilizing regimen long before conception occurs. Certain traditional medications, particularly valproate and carbamazepine, carry high risks of neural tube defects and long-term neurodevelopmental deficits, making them generally contraindicated for women who could become pregnant. In contrast, alternative agents like lamotrigine, lithium, or certain second-generation antipsychotics offer more favorable reproductive safety profiles when carefully managed and monitored. The clinical report also underscores the critical need to protect women during the postpartum period, a time when sleep disruption and massive hormonal shifts create the highest lifetime risk for severe bipolar relapse and postpartum psychosis. Rather than viewing medication as inherently harmful during pregnancy and lactation, reproductive psychiatrists advocate for a nuanced, individualized risk-benefit analysis. By making planned, gradual medication adjustments before conception, maintaining steady therapeutic blood levels, and establishing robust postpartum support systems, clinicians can keep the mother emotionally stable while minimizing potential fetal exposure. Ultimately, Psychiatric Times Medical Review delivers an empowering message for women and healthcare providers alike. Having bipolar disorder does not mean healthy pregnancy and motherhood are out of reach. With proactive medical planning, open communication, and evidence-based reproductive psychiatry, women can safely navigate family planning while safeguarding their mental health. By replacing fear-based medication drops with structured clinical care, we can ensure both mother and baby receive the highest standard of protection.